This is Dr. Susan Brown, Director of the Center for Better Bones, and today we're going to talk about the Mediterranean diet. You all heard about this diet, well known for parts of Europe and particularly Italy. The data has been collecting for years to show the really nice benefits, the nice health enhancing benefits of the Mediterranean diet. And what I'm going to talk about today is that the Mediterranean diet is very akin to our Alkaline for Life diet. I'm going to show you the principal components of each and give you some suggestions of how you can move your diet more towards a Mediterranean and alkaline diet. The Mediterranean diet basically, as this chart depicts, is lots of fruits and vegetables, nuts and seeds, some beans, herbs and spices. That's the main part of your diet. Then there's some proteins in the form of seafood, fish. There's also a little bit of protein, other sorts of protein, but much less. It's basically the seafood and the fish that's quite high. And of course, the fish has many anti-inflammatory benefits to its very high quality protein. And then poultry, eggs, and cheese. Again, more intense proteins, another tiny segment. But the basis is the fruits, vegetables, nuts, and seeds, and herbs. And they also mentioned being physically active and enjoying the meals, and particularly enjoying the meals with others. We're now seeing that our environment, our social connections, our happiness is very important to our health. We all know the Mediterranean diet really likes wine, and they find that in moderation wine is helpful. You don't have to include this, and the truth is you can get these benefits of these fruit phenolic compounds other ways outside of wine by eating the berries and whatnot, but wine is a part. Drinking plenty of water, and again we're suggesting 6 to 8 glasses of water a day. And then, of course, the olive oil is a very important component of the Mediterranean diet. If you look at it this way, you see 4 servings of fruits and vegetables. These are at least half-cup servings. We're going to see in the alkaline diet, we actually like even more than that. 1 serving of these concentrated proteins, fish, poultry, eggs, red meat, beans. You want to have adequate protein. Nuts or seeds, again, 1 or 2 servings. They find terrific benefits. Walnuts, almonds, cashews, hazelnuts, all very protective, particularly of the heart, and very anti-inflammatory. And whole grains. This can be things like rice, millet, as well as the more traditional grains that they might have used in Italy. The heart-healthy oil. We're going to talk about these oils because olive oil is now found to be very bone protective. The recommendation is to use 3 tablespoons a day of a very high-quality extra virgin olive oil, and this actually has found to increase this bone protein called osteocalcin, so you can actually stimulate new bone formation with olive oil to the tune of about 3 tablespoons. In fact, it's been so highly studied that supplements are making companies now of this component of olive oil, which is called oleopropyl, and they're making that. So if you don't want to take the oil, you can just take the supplement and get the bone-building benefits. But that oil altogether has many healthy benefits, so at least 1, maybe 3, maybe even 3 tablespoons a day, particularly if you're thin. The non-fat dairy is a great idea if you tolerate dairy. Of course, in Italy, they probably use cheese a lot. This all depends on what you can tolerate. We do know that yogurt, because of its probiotic and because of its protein and because calcium and other nutrients that it has, yogurt is very helpful for bone. In fact, studies suggest that people who consume yogurt on a regular basis actually fracture less. And I've reported that in some other blogs. The water, again, the recommendation is 6 to 8 glasses, and a glass of red wine if you like. So this is the Mediterranean diet, and what has been found, people who eat this diet, they recently did a study in Europe, 140,000 people, and they classified them according to the degree to which they followed this typical Mediterranean diet. And what they found was that hip fracture rates were significantly less in the people who did this diet. Now, that doesn't mean that the people who did this diet might have been more physically active, might have been doing more exercise, might have been happier, but I think there's a lot of data that stacks up for the Mediterranean diet. Not only really much less hip fracture, but also blood pressure was down significantly in this group. Also, the cardiovascular risk was down. The lipid profile was much better. There was less inflammation. There was better oxidative status, less antioxidant activity, and even the brain shrinkage. You know, we don't like to think about it, but as we age, our brain tends to shrink. And the people eating this diet had 1/2 the brain shrinkage of the other individuals. And then, of course, type 2 diabetes was significantly lower. So we look at all these benefits and we say, wow, this is the kind of diet we want to eat. It's a diet that helps deal with many of the degenerative diseases of today: diabetes, heart disease, dementia. And it also helps to deal with osteoporosis. So I'm going to have you see that this Mediterranean diet is very similar to the alkaline diet that I've been teaching you about so much. An alkaline diet is a diet that provides plenty of minerals and is able to buffer the acids that we produce daily. It's a diet that has full of base precursors. Those kind of diets have been shown to actually increase bone density. And I've written several blogs on that you can find if you want. But what's in an alkaline diet? Well, the fruits, again, 2 to 4 servings, very much like the Mediterranean diet. The low carbohydrate vegetables, now we suggest 3 to 4 cups. A serving of vegetables like, say, broccoli or spinach or cabbage is about 1/2 cup, they consider. 1/2 cup. So we're really talking about 2 cups for lunch and 2 cups for dinner whenever you can do it. I personally find that I have to start out my morning with vegetables. I might steam up some kale, have it with my oatmeal. I might steam up some zucchini, whatever is in season, in order to get a head start on that vegetable intake, because it's hard. I can't always get 2 cups for lunch and 2 cups for dinner. So I start out with breakfast. So 3 to 4 cups of the low carbohydrate vegetables, maybe 2 or 3 servings of the fruit. The high carbohydrate vegetables are very helpful in the form of root crops, potatoes, sweet potatoes, yams, turnips, the squashes, because these vegetables have a lot of potassium and in the form of potassium citrate, and that's a very strong alkalizing compound. So we like the root crops. They're very hardy. They keep us satisfied. We also know that we have to have adequate protein. So I suggest in the alkaline diet that we either have 1 serving, I really like 1 serving of beans like lentils or split peas or kidney beans. We especially like lentils because lentils tend to be more alkalizing than the other legumes. And we generally have 1 serving of protein of flesh food. Now, some people, if you're on a vegetarian diet and you don't want even a small serving of protein, then that's okay, eat more beans. But remember, protein is very important to bone health. And when I see people on a low protein diet, I see that their bone has suffered because of that. We always say maybe the average woman 60, 70 grams of protein, so don't cut yourself short. Have maybe a serving of beans and a serving of flesh food. Many people are drinking some protein powders. That's okay too, but you want to try to get that 60 to 70 grams. Nuts and seeds, many, many health benefits. Maybe 2 to 3 ounces, a handful of almonds, a handful of walnuts. And you can certainly have more of those, particularly if you want to keep your weight on. The essential fats, again, are very important in the form of oils. I personally like to cook with ghee and like to use ghee. However, olive oil has very excellent documentation of how it helps to build bone. So if you're really working with bone in particular, you might do the olive oil. It has to be a high quality extra virgin. It has to be green in color, and you want to keep it out of the heat, keep it out of the light, so it stays nice and fresh. And then the whole grains are, of course, part of the alkaline diet. We generally prefer the non-gluten grains like barley, millet, and even seeds like quinoa, which can be cooked like they were a grain. So this, along with dairy, we say the yogurt, you'll see this alkaline diet very similar to the Mediterranean diet. The one difference is that we really focus on having the diet lead the pH to this ideal slightly alkaline state. You've probably heard me talk about that. We're looking for a urine pH first thing in the morning of 6.5 to 7.5. And what that really means is that you've provided the body with enough minerals to buffer the acids that were incurred during everyday metabolism. Checking the pH, using the alkaline diet, and then checking the pH is a good way to assess if you're getting enough minerals. And if you're not, then you use appropriate mineral supplementation. Generally, when a person has a bone health problem, we find that they're not delivering enough nutrients to carry about normal repair of the body, and they certainly need more minerals. But you can test yourself. If you're wondering, I'm going to show you in a second how you can test your pH. This is a chart of the alkaline foods by category: the low-carb vegetables, the high carbs, the beans, the fruits, the dairy, whole grains, nuts and seeds, essential fats, and animal protein. This will be on the Alkaline for Life website. That's alkalynforlife.com. If you want to look up this chart, you can print it out, and you can kind of select your foods amongst there. So you might say to me, how do I know if my diet is like an alkaline diet? How do I know if it's delivering the kind of pH that I need to be assured that I'm setting the biochemical stage for optimum health? Well, this is really simple. What you can do is you can measure your first morning urine. And what we're looking for a pH of 6.5 to 7.5. Slightly acid or slightly alkaline. This is the range that gives us an approximation of what's going on in the tissue within the body. So it's quite simple. You get some pH paper, you get up first thing in the morning, the first urination, you measure the pH. It's so important to us here at the Center for Better Bones that we've developed the pH test kit. You can see it here. It has the book I wrote, the Acid Alkaline Food Guide. It has sample menus. It has the pH paper. It has everything you need to see if your diet, which hopefully is a lot like the Mediterranean diet and hopefully is an alkaline diet, if your diet is providing all the minerals you need. So I hope you get a chance to look at your diet, test your pH, and make some adjustments. Now we're getting into the summer. It's a great time of fruits and nuts and vegetables and berries. All those things are so highly alkalizing. So I hope you have a great time eating wonderful summer foods, and that all of us would take seriously checking their pH to make sure you're on the right track. Okay, well, I'll talk to you all soon. Have a great spring.